For today's lecture, we are going to talk about the fetal period. We will discuss the different changes from the third month up to birth, and we will talk about the time of birth. I will try to teach you how to calculate for the estimated date of delivery, and we will also consider some of the clinical correlates. But before anything else, let us recall what happened during the embryonic period. The embryonic period, otherwise known as the period of organogenesis, would cover the 3rd to 8 weeks of development. And during the 3rd week of development, that is when gastrulation happens, whereby the 3 germ layers are formed. And these different 3 germ layers will later on develop during the rest of the following weeks into the different organ systems of the body. Another important event during embryonic period would be the body foldings are established here, and the different features of the external body form would already be recognizable at the end of embryonic period. Which developmental process is interrupted in this condition, and how can this be prevented? If your answer is it's a kind of neural tube defect, particularly spina bifida, then you are right. This can generally be prevented by a daily intake of the woman of, say, 400 micrograms of folic acid. But if she is trying to conceive, it is recommended to have a daily dose of 1,000 micrograms of folic acid. The period from the beginning of 9th week to birth is known as the fetal period. It's characterized by maturation of tissues and organs as well as rapid growth of the body. The length of the fetus is usually indicated as the crown rump length, or CRL, otherwise known as the sitting height, or as the crown heel length, CHL, the measurement of which should be taken from the vertex of the skull going to the heel, and thus it's also called the standing height. Now these measurements are expressed in centimeters and are correlated with the age of the fetus in weeks or months. The growth in length is particularly very striking during the 3rd, 4th, and 5th months, while an increase in weight is most striking during the last 2 months of gestation. In general, the length of pregnancy is considered to be 280 days or 40 weeks after the onset of the last normal menstrual period. More accurately, that would be 266 days or 38 weeks after fertilization. So this is the table showing the correlation of growth in length and weight during fetal period. So relatively, there is a slowdown in the growth of the head as compared to the rest of the body. At the beginning of the 3rd month, the head would constitute approximately half of the crown rump length. By the beginning of the 5th month, the size of the head is about 1/3 of the crown heel length. And at birth, it is approximately 1/4 of the crown heel length. And as you can see, over time, the growth of the body accelerates, but that of the head slows down. Still, the head would be the largest circumference once the baby is born. During 3rd month, the face becomes more human-looking. The eyes that is initially directed laterally will move to the ventral aspect of the face, and the ears will now come to lie close to the definitive position at the side of the head. The limbs reach their relative length in comparison with the rest of the body, although the lower limbs are still a little shorter and less well developed than the upper extremities. During this time, the primary ossification centers are present in the long bones and skull by 12 weeks of development, and also By this time, around 12 weeks, the external genitalia will develop so that you could already determine the sex of the fetus by this time through ultrasound. During 6 weeks, the intestinal loop will cause a large swelling or herniation in the umbilical cord. Now, this is a physiological herniation, it's normal. But by the 12th week, the intestinal loop should withdraw into the abdominal cavity. At the end of the 3rd month, reflex activity can be seen in aborted fetuses, indicating that there is already muscular activity by this time. During the 4th and 5th months, the fetus would lengthen rapidly, and at the end of the first half of intrauterine life, the crown rump length is approximately 15 centimeters, about half the total length of a newborn. The weight of the fetus will continue to increase, but very little during this period, so that by the end of 5th month, the fetus would only be less than 500 grams. By this time, the fetus is covered with very fine hair, and we call this the lanugo. The eyebrows and the head hair are also very visible. During 5th month, movements of the fetus can be felt by the mother like a fluttering butterfly in the abdominal area. And during the second half of intrauterine life, the weight would increase considerably, especially during the last 2 months. There is not much connective tissue under the skin. That's why at 6 months and 7 months, the fetus would appear reddish and wrinkled in appearance. And if the fetus is born very early during the 6 months, its chances of surviving would be slim because the respiratory system and the central nervous system would not have differentiated enough, and coordination between the two systems is not yet well established. Of course, you have to consider as well the production of surfactant at early stages, like early 6 months. Well, surfactant would not be enough, and surfactant is really needed to allow the lungs to expand, because what it does is it reduces the surface tension of water in your lungs. However, by 6.5 to 7 months, the fetus would be already around 25 centimeters based on crown rump length and would weigh approximately 1,100 grams. If the fetus is born at this time, he would have or she would have greater chances of surviving. That would be around 90%. During the last 2 months, the fetus would obtain a well-rounded contour because more subcutaneous fat would be deposited. And towards the end of intrauterine life, the skin would be covered by a whitish, fatty substance. We call this the vernix caseosa, which is actually composed of secretory products from the sebaceous glands. These sort of like protect the fetus from abrasion or mechanical injury. So it's a lubricant. At the end of the 9th month, the skull would have the largest circumference of all parts of the body, and this is actually an important fact, especially with regards to its passage through the birth canal. And at the time of birth, the weight of a normal fetus would be somewhere around 3,000 to 3,400 grams. Its crown rump length is around 36 centimeters and its crown heel length is about 5 centimeters. Of course, the race would play a big factor on these data. You'd expect a much, lesser crown heel length, for example, for Asians. Sexual characteristics would also be very pronounced, and the testes should already be found or seen in the scrotum. Let us consider this case. A child is born with a large defect lateral to the umbilicus. Most of the large and small bowel protrude through the defect and are not covered by amnion. What is the embryological basis for this abnormality? And should you be concerned that other malformations may be present? So this is actually a case of gastroschisis. It's a term applied to a protrusion of abdominal contents into the body wall directly into the amniotic cavity. Because the viscera are not covered by the amnion, it's very possible that the bowel may be damaged by exposure to amniotic fluid. This actually occurs in 1 out of 10,000 births, but it seems that it's already increasing in frequency, especially among young women. And they are saying that the increase may be related to the use of the drug cocaine. Unlike omphalocele, gastroschisis is not associated with chromosome abnormalities or other severe defects, so the survival rate is actually excellent. It is, however, possible that some of the bowel would rotate abnormally, and we call this volvulus, and this might compromise the blood supply and can even kill large portions of the intestine and lead to fetal death if volvulus is present. In calculating the estimated date of delivery, what we first do is determine the first day of the last normal menstrual period, for example, March 1, 2017. And then you add a year from that, so that would be March 1, 2018. Subtract 3 months will give you December 1, 2017, and you add roughly around 7 days, and so the expected date of delivery would be somewhere around December 8, 2017. Now try to do this on your own. Try to solve the expected date of delivery if the first day of the last menstrual period is January 3, 2017. And for the second problem, if it's April 10, 2017, what is the estimated date of delivery? The date of birth is most accurately indicated as 266 days or 38 weeks after fertilization. However, a woman would usually see her obstetrician when she has already missed 2 successive menstrual bleeding. By this time, her recollection about coitus is usually vague, and it is readily understandable that the day of fertilization might be difficult to determine. And so we calculate the date of birth as 280 days or 40 weeks from the first day of the last normal menstrual period. But take note that we are basing this in a woman whose menstrual cycle is a regular 28-day cycle. However, there are some women who have irregular menstruation or another complication in computing for the estimated date of delivery would be the occasional erosion of the endometrium resulting to bleeding during implantation. So the woman might confuse that as a menstrual period. And so the date of delivery is not always easy to determine. But we still need to know the expected date of delivery, because if the baby are born much earlier, they would be categorized as premature, and if they are born much later, they could be considered as post-mature. A very usual tool in determining the age would also be the ultrasound, which can provide an accurate measurement of the crown heel length during the 7th to 14th weeks of development. In the next video, we'll be talking about placenta, the fetal membranes, and also twinning. The date of birth is most accurately indicated as 266 days or 38 weeks after fertilization. However, a woman would usually see her obstetrician when she has already missed 2 successive menstrual bleeding. By this time, her recollection about coitus is usually vague, and it is readily understandable that the day of fertilization might be difficult to determine. And so we calculate the date of birth as 280 days or 40 weeks from the first day of the last normal menstrual period. But take note that we are basing this in a woman whose menstrual cycle is a regular 28-day cycle. However, there are some women who have irregular menstruation or another complication in computing for the estimated date of delivery would be the occasional erosion of the endometrium resulting to bleeding during implantation. So the woman might confuse that as a menstrual period. And so the date of delivery is not always easy to determine. But we still need to know the expected date of delivery because if the baby are born much earlier, they would be categorized as premature, and if they are born much later, they could be considered as post-mature. A very usual tool in determining the age would also be the ultrasound, which can provide an accurate measurement of the crown heel length during the 7th to 14th weeks of development. In the next video, we'll be talking about placenta, the fetal membranes, and also twinning. Meanwhile, this ends our lecture, and always remember, life is beautiful.